Here's my paper. Nothing is written on it. And the back sides are blank as well. All right. Hi, my name is Anna and I'll be your student nurse today. I'm going to be doing a head to toe assessment on you. Can you give me your name and date of birth?
Jamie Eggert in 42503.
Alright, Jamie, do you know where we are today?
In Saginaw.
Alright, and do you know what month it is?
April.
And do you know what year it is?
2024.
Alright, you are 8 out of times 4, so I feel comfortable moving forward with the assessment. I'm first just going to ask you a few questions. Do you have any medical diagnoses, history, recent surgeries I should be aware of?
Nope.
Alright, do you have any family medical history?
Nope.
Do you take any medications?
Nope.
Do you take any like herbs or supplements?
Mm-mm.
Do you have any allergies?
No.
Alright, and how is like your exercise and diet?
I'm a college student, so the diet's kind of like all over the place, but I try to get in protein and grains every day, and then I exercise probably about 5 days a week, being like running, dancing, or walking.
Okay, great. And do you smoke, vape, use tobacco products, anything
No.
like that? Do you drink any alcohol?
No.
Alright, great. So those are all the questions I want to ask you for right now. I'm first going to start by getting some vitals on you. So I'm going to take your blood pressure. Do you have a preferred arm for your blood pressure? No? Alright, I think I'm going to do it on this arm here. Alright, you can just kind of relax your arm. Oh, so sorry. There you go, perfect. Alright, for your blood pressure, I got about 118 over 70. Does that seem like a normal range for you?
Mm-hmm.
Alright, great. Alright, if I had a pulse ox, I would check your oxygen saturation and expect it to be around 95 or higher. But since I don't have one, I'm just going to look at your hand for any signs of clubbing. No signs of clubbing. And your capillary refill is all under 3 seconds. So that tells me that you have good tissue perfusion and oxygenation. And I don't have a thermometer, or else I would take your temperature. Do you have any signs of like fever? Are you sweating, clammy at all?
Nope.
Alright, then I would expect your temperature to be around like 98.6 or something like that. So that's really good. So the next thing I'm going to do is I'm going to take your pulse. So I'm just going to use your wrist. Alright. I'm just going to count your pulse for 1 minute. Alright, so your pulse was 75 and your respirations were 16, so that's within range and normal. So the next thing I'm gonna do is I'm just gonna do an assessment of like your scalp and your skin and your face. Is that okay?
Mm-hmm.
All right. So I'm first just gonna feel around your hair. Do you dye your hair at all?
No.
All right. Do you notice any like signs of like itching, dryness, anything like that?
Nope.
All right. Great. So your hair is all healthy, no lesions or anything. I'm just gonna palpate your scalp. Let me know if there's any pain or tenderness with that. Any pain or tenderness?
Nope.
Alright, great. Over here, I'm gonna just feel for your occipital lymph node. Alright, I'm gonna feel for your pre-auricular, post-auricular, submandibular, submental, and then your cervical chain. Alright, and then can you just kind of like stretch your shoulders like that for me? Alright, I'm gonna move your arm just a little bit, and I'm gonna feel your supraclavicular lymph nodes. Alright, over here, I'm just gonna test your tissue turgor. Alright, perfect. You can relax. So your lymph nodes are all non-palpable, and your tissue turgor is good. There was no tenting, so that shows me you have good hydration. So next, I'm just gonna look at your ears. Do these piercings give you any trouble?
Nope.
Alright, great. So I'm just gonna look inside your ears. Looks good, no sign of drainage or anything. I'm just gonna palpate the pin of your ear. Any tenderness with that?
Nope.
I'm gonna do the same thing on this side, looking in your ear. Looks good and healthy, no drainage. Any pain or tenderness with that? Alright, great. So the next thing I'm gonna do is I'm first gonna like palpate your sinuses. Let me know if there's any pain or tenderness, okay? Those are your frontal sinuses and your maxillary. Any pain or tenderness? Alright, great. Next thing I'm gonna have you do is I'm gonna have you plug one side of your nose and breathe in and out. Alright, another side. Alright, perfect. Do you have any trouble with your piercing?
Nope.
Alright, great. So I'm gonna have you close your eyes, and I am going to just hold something under your nose. I'm gonna have you tell me what it is, alright?
It's coffee.
Coffee, alright, yep. You can open your eyes. So that was testing your cranial nerve 1, and that's intact. Do you wear any glasses or contacts?
Nope.
Alright, so if I had a Snellen chart, I would assess your vision. But do you have, since you don't wear contacts or glasses, do you have any trouble seeing?
Mm-mm.
Alright, so since I don't have a Snellen chart and you don't have any issues with your vision, I would expect your cranial nerve 2 to be intact. So next thing I'm going to do is I'm going to do some assessments with your eyes. So I'm going to shine my pen light at your eyes. I'm just going to have you look straight at me, okay? So first on this side. Sorry, I know it's a bright light. Alright, great. Alright, and then I'm going to have you look at my pen light, and I'm going to have you follow it with just your eyes, alright? Alright, great. I'm going to do a few more tests with the pen light. So I'm going to have you look at my pen light, look at my hand, look at my pen light, look at my hand, pen light, look at my hand. Great. Alright, and then I'm going to have you touch your nose, touch my pen light, touch your nose, touch my pen light, touch your nose, touch my pen light. Alright, great. So that was testing your cranial nerves 3, 4, and 6, and those are all intact, and your eyes are round, equal, reactive, and accommodating. So your eyes are perla, the whites of your eyes, and that's your sclera, and that all looks nice and white, and no discoloration or anything like that. So next thing I'm going to have you do is I'm going to have you make some silly faces at me. So I'm going to have you smile, make a surprise face, make a mad face. Alright, great. And then I'm going to have you close your eyes, and I'm going to touch a few places on your face. Let me know where I'm touching, alright?
Forehead. Left cheek. Right cheek. Chin. Nose.
Alright, great. You can open your eyes. So that was testing your cranial nerves 5 and 7, and those are all intact. So next, I'm going to have you tilt your head back. I'm just going to look up your nose. Alright, great. You can open your eyes and look at me. So your mucous membranes in your nose are nice and pink and moist, even hair distribution, no polyps, no deviated septum. Have you ever broken any bones in your nose or face?
No.
Alright, great. So next I'm going to do some assessments with your mouth. So I'm first just going to look in your mouth with my pen light so you can open your mouth. Alright, looks pink and moist, no broken teeth or anything like that. So I'm going to look in your mouth again. This time I'm going to have you stick out your tongue. Do you have a gag reflex?
A little bit.
Alright, I'll be careful not to put the tongue depressor too far back. I'm going to have you stick out your tongue and say ah.
Ah.
Alright, great. Your uvula rises upon phonation, so that looks good. I'm gonna have you stick your tongue out at me one more time. I'm gonna have you move your tongue up and down, side to side. All right, perfect. So that was testing your cranial nerves 9, 10, and 12. So those are all intact. I'm gonna do one more test with my pen light, and then we'll be all done with that. So I'm just gonna have you look straight at me, okay? All right, that was testing your corneal reflex. So that all looks good there. So next, I'm gonna do some range of motion exercises. I'm gonna look at the skin on your arms first. So I'm just gonna check. You have a few moles and freckles, but the temperature is good. I'm gonna look at this arm as well. Same thing here. And muscle symmetry is nice and even. Tone is good. So I'm gonna put my hand on your shoulder and have you make a swimming motion with that arm, okay? All right. All right, any trouble with that? All right, I'm gonna have you do the same thing on this side. All right, perfect. That all looks good. All right, I'm gonna have you squeeze my fingers. All right, perfect. I'm gonna have you press my hands together. All right, and I'm gonna have you press them out. All right, perfect. While we're here, I'm gonna test your cerebellar function. So I'm gonna have you make an okay sign with your hand. Touch each finger to your thumb, and then go as fast as you can. All right, perfect. I'm gonna have you put your hands on your lap, turn them over, and then go as fast as you can. All right, great. So your cerebellar function is all intact. That all looks good. Well, I'm still having you facing forward. I'm gonna feel for your carotid arteries on both sides of your neck. I'm gonna listen with my stethoscope for any bruise. All right. All right. So I'm first gonna palpate for your carotid. All right, and I feel it right there. So I'm gonna have you hold your breath for just a second, okay? All right, perfect. You can breathe. No bruise heard on that side. All right, feel it right there. Hold your breath. All right, no bruise heard, so that all sounds good. All right, and I'm just gonna look at my paper for a second. All right, I'm ready to have you turn and face that way. So without getting, I'm just gonna have you turn around. All right, perfect. Is it okay if I untie your gown?
Mm-hmm.
All right. Okay. So first, actually, I'm gonna reach around your neck, and it might feel just some discomfort, but it shouldn't hurt. And I'm just gonna feel. For your thyroid, so I'm gonna displace your trachea, palpate, and then on the other side. All right, no lumps or nodules with that, so it all feels good there. So now what I'm gonna do is I'm gonna be listening to 12 different spots on your back for your lungs. So I'll stop halfway through at 6 if you need a break, okay?
Mm-hmm.
All right, first I'm just gonna have you bring your shoulders back. All right, great, you can relax. All right, so every time you feel my stethoscope move, take a deep breath, okay? All right, that was 6. Do you need a break?
Mm-mm.
All right. All right, I'm just gonna go under your brow just a little bit, okay? Alright, all sounds good there. So now I'm going to percuss on those same spots. So you'll just feel some tapping, okay? And here I am wanting to hear resonance. Alright, so I hear resonance in all the spots, so that's good, and that's what we like to see. So I'm going to have you lay down, and I'm going to take away your pillow for just a second. Alright, and I'm going to have you look towards the wall. Alright, and look towards me. Alright, perfect. I'll give you your pillow back. I was just looking for any jugular vein distension. If I saw any signs of JVD, I would raise the head of your bed to around 45 to 60 degrees and check for fluid overload, but I'm not seeing any signs of that. So next thing I'm going to do, is it okay if I pull down your gown a little bit? Alright, so I'm just going to pull it down a little, keeping you as covered as possible. So sorry, hey, let me pull that back up there. There you go. Alright, so I'm going to be listening to different valves of your heart. Alright, so I'll first start with my diaphragm of my stethoscope, and then I'll listen with the bell. Alright? Alright, so I'm going to start on your right side. So this is your clavicle. So clavicle space. Rib 1. Rib 1. Space. Rib 2. Space. So listening at your aortic. Alright, lub dub is heard. Switching over to my bell for any murmurs. Lub dub heard and no murmurs. I'm going to come over to your left side. So here's your clavicle, space, rib 1, space, rib 2, space. So this is your pulmonic. Alright, lub dub heard, switching to my bell. Listening for any murmurs. Alright, lub dub heard and no murmurs. Alright, I'm going to go back up to your clavicle. So it's your clavicle space. Rib 1, space. Rib 2, space. I'm going to go under your broad lobe, is that okay? Rib 3, space. So this is your herbs point. Alright, lub dub heard. Listening with my bell, lub dub heard and no murmurs. Alright, back to your clavicle and then space. Rib 1, space, rib 2, space, rib 3, space. I'm going to reach up on your brow a little bit, okay? Rib 4, space. So listening at your tricuspid. Alright, lub dub heard and no murmurs. Or lub dub heard. Now I'm going to listen for no murmurs with my bell. Alright, no murmurs. Alright, now I'm going to go to your 5th rib, 5th space, and go mid-clavicular line, which is right here. I'm going to listen with my diaphragm. Alright, lub dub heard. Listening for murmurs. Alright, and no murmurs heard. I'm going to switch back to my diaphragm, and I'm going to listen for a full minute. This is your apical pulse, and it's the most accurate pulse on your body. Alright. All right. Your apical pulse was 78. So the next thing I'm going to do is I can pull your gown back up. There you go. All right, now I'm going to do an abdominal assessment. Is it okay if I pull your gown up? All right, I'll cover you with a sheet. All right, so I'm just going to pull your gown up a little bit. Perfect. Is it okay if I move your shorts down just a little? All right. Okay. So I'm going to be listening on your abdomen, but first I'm going to check for symmetry breathing, and that all looks good. No lumps or anything. All right, so I'm going to be listening in for your bowel sounds. So I'm going to start on your right lower quadrant. All right. All right, bowel sounds are active and present. So now I'm going to be listening for your abdominal arteries. So I'm going to be listening with the bell of my stethoscope, just listening for any bruise. So I'm going to find your xiphoid process, your belly button, meet in the middle, and that is your abdominal aortic artery. All right, no bruise heard. So I'm going to move to your right renal artery. And then go straight across to your left renal. And then your left iliac. And your right iliac. All right, and that all sounds good. No bruise were heard. So now I'm just gonna percuss on your abdomen, so you're just gonna feel some tapping, okay? All right, and I hear timpani and all of that, so that sounds good. And now I'm just gonna percuss again to find your liver border, okay? I'm gonna percuss until I hear dullness, and that'll indicate your liver border. All right, your liver border is about here, because that's where I heard dullness. So now I'm gonna do some palpation, so I'm just gonna feel lightly on your stomach. Let me know if there's any pain or tenderness, okay? Any pain or tenderness there? No. All right, I'm gonna do a little bit deeper. All right, any pain or tenderness? All right, great. I'll pull your gown down. All right, the next thing I'm gonna do is I'm gonna find your femoral pulses, all right, at your femoral arteries. So I'm gonna pull the sheet down a little bit. So is it okay if I just reach up your shorts a little? All right, so after I find your pulses, I'll be listening to them with my stethoscope, listening for any bruise, okay? All right, so I'm just gonna feel on this side. Could you bring your leg up and bend it there? Perfect. All right, I feel it about here. So I'm gonna listen with my bell. All right, no bruise heard. So I'm gonna have you bend this leg. Perfect. I'm gonna palpate through your femoral artery here. All right, and I feel it about here. So I'm gonna listen. All right, great. No bruise heard. I'm gonna palpate for both of your femoral pulses one more time. All right, I'm just gonna feel for symmetry. I'm just gonna reach up your shorts if that's okay. All right, those are both strong and symmetrical, so I can pull your gown down. I'm gonna pull the sheet down. Perfect. All right, so I'm gonna move on to your legs. Looking at your legs, color looks nice and even. Temperature feels good. And muscle tone and symmetry is nice and even. So I'm gonna reach under your knees and feel for your popliteal pulse, all right? All right, those are felt in both of your popliteal pulses, and those are even and symmetrical and strong. So I'm going to come down here and feel for your posterior tibialis pulses. Alright, those are strong, even, and symmetrical. Would you like to take your socks off, or would you like me to take them off?
I can take them off.
Okay, thank you. Alright, great. Now I'm just going to feel for your dorsalis pedis pulses. Alright, great. Those are both strong, even, and symmetrical. Over here, I'm just going to check your capillary refill, which is all less than, sorry, sorry, I didn't mean to tickle your toes. All less than 3 seconds, so that all looks good there. So I think I'm ready to have you sit at the side of the bed. Would you like to put your socks on, or would you like me to put them on for you?
I'll put them on.
All right, so once you have your socks on, you can sit at the side of the bed, but don't stand up yet. While you're doing that, I'm just gonna check my paper. Okay, there's actually one more test I'm gonna do before I continue with the assessment. Can I actually have you lay down one more time?
Mm-hmm.
Sorry to have you up and down, but I'm actually gonna have you close your eyes, and before you close your eyes, this is dull and this is sharp. Can you tell the difference?
Mm-hmm.
All right, so I'm gonna have you close your eyes, and I'm gonna touch some points on your legs and feet, and let me know where I'm touching, all right, and if it's sharp or dull.
So my leg and that's dull. Leg and dull, like thigh and dull.
Mm.
Knee and sharp. Knee and dull. Knee and sharp. Knee and sharp. I mean, wait, no, not knee. Like shin and sharp, shin and sharp.
And then
Foot and dull. Foot and dull.
all right, great. And now I can have you sit up and sit at the side of the bed. Thank you for your patience in doing that. All right, so a few things I'm gonna do. I'm gonna test your patellar reflex, okay? So I'm just gonna hit a point at your knee, all right, to test for that patellar reflex. All right, test the other one. All right, those look good. So I'm gonna do a few strength tests with your legs, okay? So I'm gonna have you lift your knee. All right, you can put it down. Lift your other knee. All right, great. I'm gonna put my hands on your feet. Lift your toes to the sky. All right, and then press down like a gas pedal. All right, perfect. And then can you just move your ankles in a circular shape? All right, perfect. Any trouble with that at all?
Nope.
All right, great. So I'm gonna have you put on your shoes. All right, perfect. So when I have you stand up, I'm gonna have you stand up kind of shoulder width apart with your arms at your side. I'm gonna have you close your eyes and just stand like that for about 10 seconds, okay? All right. All right, great. You have a negative Romber test because I didn't know any swaying, and that was also testing cranial nerve 8, so I feel comfortable walking you. So I'm just gonna have you take a few steps normally forward. All right, perfect. Then I'm gonna have you turn around and walk back, but walk heel to toe. All right, great, and you can take a seat. All right, and you said your diet and your exercise are pretty good, and you're pretty mobile. Do you notice like any sweating or a lot of moisture or anything?
Nope.
All right, great. So since you're pretty mobile and active, you're not sitting for long periods of time or have a lot of moisture, I don't think you're at any risk for pressure ulcers. So I'd give you a Braden scale of 23, which is a perfect score because I don't see any risk for that. So do you have any questions for me? Alright, I'm gonna check my paper one more time. Alright, and if you don't have any questions for me, that concludes the head to toe assessment.
Thank you.